Hello, everyone, and thank you very much for participating in this roundtable. Also, thank you very much to Guy for this absolutely wonderful intro that actually puts the topic related to the patient in the very core of the topic that we will be considering today and tomorrow. And I believe that the patient-related topic is something that we should work together on. So today, during this roundtable, we'll be talking about predicting, about this notion, because it actually tackles different realities, because we can talk about prediction that we can see in the magazines. Let's say a watch that has won this award of the watch of 2022, which actually can predict how much time you have left to live. And it actually takes into account genetics, psychosomatics, and so on. And it's actually a very interesting topic, and it's also called predicting. And also we have medical uses that are used today, and they can also change the care that we take of the patient and improve the health care of the patient. We can actually have this possibility of predicting with respect to the appearance of the disease, of the dissemination of the disease, prediction of its evolution, and so on. That's what we did with COVID. And we also have predicting in terms of the efficiency of the treatment. That's what we can see today also. But we also have the proactive diagnosis, and we're talking about the breast cancer as an example here. Also, we can have some predictive system that can talk to us about the trajectory of health and of life. So today, the dynamics related to the health and the massification is already launched. So the question that we would like to tackle at this roundtable is, to what extent, how do we do it, and what is the place of the patient? Because whenever we're talking about the predictive analysis, is the notion of the patient is fair within this framework? So for some 40 minutes, we will be talking about this notion and the current situation, but also we will be talking about forecasting, because it's also important to prepare this transformation of the care. So just to start, I would like to probably talk to Jeanne, because you are the associate lawyer, and I would like to have your point of view, the point of view of lawyer, of a legal person, on the framing of this notion of predicting. What can you tell us about this? Well, yes, thank you very much. Indeed, the term of predictive analysis can basically cover many very different situations, just as you have mentioned, because we can talk about, at least from the legal point of view, we have some situations that are simpler or easier than others. Let's say to predict the therapeutic efficiency of a medicine coming from an analysis that we have from the data of some other patients, and then to apply it to the examination of the characteristics of the disease of this particular person in order to, let's say, select a chemotherapy that will be more or less efficient. This is the very first case, but we also can have some other cases that can also and must also be framed from the legal point of view, but from the medical point of view, they're not that difficult, because this is all for the advantage of the patient. On the other hand, we have much more complex cases, let's say, whenever we are talking about the examination of the genetic characteristics of a person, let's say, to predict the possibility of an appearance of a pathology, probably coming from the family, from the genetics, or so on, because probably this will be something that we don't know how to treat today. So in this second case, we can see that the ethical, moral problems arise here, and we have to frame somehow all of this. We are in this country that loves laws, so we basically have everything that is needed in order to frame all of these situations, but the difficulty here is to apply them in practice. We don't have to forget today, with the development of what we call today artificial intelligence, that we need data, a lot of data, and we have two very important legal bodies that can be applied here. First of all, everything that is with respect to the access to data, because we have to observe and interpret. So we have all this legal body for the reuse of health-related data. We are talking a lot about it, and it is very complicated even today, even though we can see how we can have all the different pathways and possibilities probably to simplify all of this, especially talking about the algorithms that can also talk about the medical devices that we have and all the requirements that we have from the legal framework at the European level. We also have the general regulation related to the protection of personal data data and also the freedom in terms of IT and so on. Well, we have this legal body that is here. I will not go into the details because we don't really have the time for that. But also we're tackling everything that goes with respect to the rights of a person. And whenever we're talking about this, we have two types of a person. So we have this person whose data we are reusing, because for predicting we actually are using the data from someone else. So how can I inform the person that I'm using their data and what are the rights of this person? And on the other hand, we have the person to who will be doing this predicting. So how can we respect their rights as well? So we can basically develop these two important points. Thank you very much for this very first point. Nicolas, you are coming from the economical background, and I believe that you have a very personal experience related to the predictive analysis. Can you possibly give us an explanation about the current situation in the world? Well, for me, the predictive analysis in health, this is the topic that I have been fascinated with for some 10 years. And I actually like, whenever I'm working with all of this, I'm always very much interested, and I'm especially very much interested by tangible things. And what I can also say that the cabinet that I'm in charge of is also working with this company, which is called Starcage, and we are doing the prediction in a very, very precise field, which is the prediction of aging. So this idea when aging can be also considered as a pathology, or at least partially considered as a pathology, and probably try and somehow slow it down. So I was working on this clinical trial, and I found it absolutely fascinating. And also I understood, at least I think so, the implications from the economic point of view, because in reality, predictive analysis, I believe that it does not reduce the expenditure for health. It actually places it in another place. Why? Because you have this questionnaires, and they are quite lengthy. Well, of course, it's not a problem. Then you have all the assessments and medical assessments and so on. And then we have the analysis, blood analysis. I believe that this is also quite painful. But in my case, we identified a very important risk factor approximately at 20-year-old stage. So we actually have to change the behavior, because it's actually quite difficult, because if something can be avoided, something that is potentially problematic, we have to do it. So we are basically going into the action right here, but we are also doing the preventive medicine. But this is still medicine, and I believe that the error that we can avoid here, and I will be listening to the next round table, but I believe that preventing is pretty much the same thing. So we can do an absolutely incredible thing in terms of predicting and preventing, and then we will be doing a lot of savings in terms of health. I believe that this will be really a destructive mechanism, because basically we are just placing in another, just moving to another place all of this expenditure for the medicine. So for me, the main stake related to the predictive analysis, and I believe we will be talking a lot about the ethics, but for me, this is something that is very, very simple. Well, that's a great segue. Yes, well, frankly, I believe that we can do this poll about the ethics and so on, and 80% or 90% will vote exactly the same thing, so this is not something that is complicated. Yeah, but, well, seriously, when we're asking this question, that if we identify a certain type of factors, would this be normal, that the health insurance will put a higher rate, everyone will say no, so we won't be spending too much time on that, I believe. But the real difficulty, because we actually have to put our intellectual resources to the problems that are very complicated. So the real difficulty is what we can say a scalability, meaning that how, and well, right now the predictive medicine is very expensive. I did that, and it was 5,000 euros of price, so we cannot really scale it. So how can we bring down the cost of the predictive medicine from 5,000 to 500? Even 500 is very expensive, and to 50, which will allow it to become a commodity, because it would be good to make sure that everyone can consume it. And this is a real topic of an economist, meaning that if we do not do this, we will have some technical potential, and some of us will be able to do this, but not all of them, and it will not really have a change, an impact in terms of change at the level of the society, and we won't be able to have this life experience with good health, which is our final goal here. So these are the questions. A investment into technology, into human capital, and into the organization. And what I find really fascinating is that this topic actually orients us toward the future. So we are thinking about this topic, and we're trying to do this starting from now, which is not easy because the predictive medicine, are we ready for that? We are not really ready for the medicine today because right now we have the system of health which goes back to the 20th century, whereas we are in the 21st century. So whenever we will be advancing, we will have this blocking, this situation that will be very interesting related to the potential and the organization that will not allow us to really use all the technical potential that we have. Thank you very much for these thoughts. And now I would like to address you, Ritva, especially with respect to the notion of the prospective point of view, prospective standpoint. If we think about 2030, what would be for you this predicting scenario for patients? Can you possibly describe it to us? And what are the stakes, the challenges that we are facing today? Can you please describe it to us?
Should I use only just like 5 minutes, or can I use 5 hours for this?
It's better 5 minutes than 5 hours, but takes time.
I understand that. So in 5 minutes, so it's. I think this is a very difficult question. So that to predict what is going on in future, and so we have to look at today's development and today's research. If we think about future, and there are a lot of new things that are coming and that are studied at the moment, and so new technologies, so they all have their own problems or things to discussion, and also ethical principles and ethical issues that are there at stake. For example, in artificial intelligence that was just discussed, so the privacy of persons and also the mechanisms how the data is collected and how it is analyzed, so that makes new assumptions that might not be right for the certain patient, and also this prevention. I am also a very good support of prevention, but anyway, so patients do not choose their diseases, so that any of us can have a rare disease, for example, and so although we live a good life and not smoke and not drink and have healthy food and so on, so anything can happen, and so we don't have a personal future for our lives, and therefore we have to trust to healthcare that is providing health for or healthcare for everybody, and that is problematic also with these future technologies. One thing is that the more personalized medicine is coming, so the more expensive it will become. And already now we have a situation where some national organizations have decided that this certain medicine or this certain treatment is too expensive for our country. But there are a lot of things that have to be thought beforehand already, before 2030, so that everybody, or at least the most people, have access to new technologies when they need that, and they could benefit the development of science and technologies in the situation when they could benefit from that certain treatment or certain medicine. And I think this is one of the key issues for 2030, the equal access for everybody to new technologies and healthcare.
Merci beaucoup. Thank you very much.
I also had a question related to up to what extent the technologies can go. Well, I see that Bertalan is not connected, or is he? So I would like, oh, Bertalan is here. So this is great. So I wanted to ask you this question because you are a futurist. I would like to know, what is your vision with respect to what extent the technology can go, up to what point the technology can go? So what would be your vision with respect to 2030 about this topic?
Well, good morning to you all, and thank you so much for having me. Just first of all, I want to make sure that we're on the same page when we talk about predictions. Because whenever I talk about predictions to people, most people think that there is a definitive future for healthcare, and our job is to predict that definitive future. But that's, I hope you know, it's not the case. What I think the job of futurists is, and anyone who want to do foresight, is to create visions about the future of healthcare and medicine, and then come back to the practical reality of today and try to find out what we should be doing right now to get to those desired visions and not the other ones around. That's the real essence of predictions and doing foresight. But now, answering your question, I do have a vision, and we at the Medical Futurist Institute have a vision about the state of healthcare in 2030. And as there is a paradigm shift currently going on in healthcare globally, which is about welcoming patients as the newest member of their medical team, it's quite easy to expect that by 2030, digital health technologies could make patients the point of care, finally. That will be the end story of the whole digital health revolution. It would make healthcare globalized, but in essence, it would be like a revolutionary new thing that patients can take active part in their care. It might not sound like something like a breakthrough to us now, but imagine that for 2,000 years, only medical professionals could access data, information, knowledge, experience, wisdom within the ivory tower of medicine. But the introduction, the influx of advanced technologies, from wearables to artificial narrow intelligence to patient empowerment applications, it started becoming clear that the ivory tower is breaking down, and now patients are sitting at the same table where only medical professionals have been sitting for hundreds, if not 2,000 years. So my vision about 2030 is around the idea that wherever patients are, whether they are at their home or on their way to somewhere or at a point of care hospital, they will be able to receive diagnosis, monitoring, and treatment because they have access to advanced technologies. They use sensors and portable diagnostic devices that would allow them to share data with medical professionals being at the point of care. And third, and that's going to be the next paradigm shift after the current paradigm shift is over in about 5 to 10 years, we will have one new member of that medical team that now involves patients, artificial narrow intelligence, automation, being able to help and maybe even replace any repetitive and database task that medical professionals have to do today. And if we look through a normal day for a patient, then I would say that they are not using technologies every single day. Their time is not spent with analyzing data and those wearable devices and so on, but they can live their lives to the fullest. They can deal with the potentials they have. If they are teachers, they can focus on that. If they are athletes, they can try to get better at that, but they don't have to deal with their healthcare because data coming from the technologies they are happy to use help deal with this by making them the point of care. That would be the essence of our vision for patient in 2030.
Thank you very much, Bertalan. Je crois que Nicolas voulait réagir sur ce sujet.
I think that Nicolas wanted also to react to all of this. Yes, well, I'm very much a fan of technologies, but I believe that we have to be very rigorous with respect to these questions. We don't have to give false hopes to people. The very first thing that we have to explain here is that the clinical studies in terms of predictive analysis are very long, and especially when we're talking about the longevity. So I believe that we actually have to follow people up for many dozens of years, and right now we are at the very beginning of this process. And if we really want to have databases that will be very good, we actually will have to wait, I believe, 30, 40, 50 years and even more. This will be a lengthy process because, well, this is something that actually is related to the topic that we're tackling right now. The second point is that we actually have to remind that we can have quite a lot of problems that cannot be predicted in social life. And I'm not a doctor, and I'm basically behind all the doctors that are here, but it's also true in the field of biology. And from the point of the communication and marketing of different companies that will be selling this type of service, I believe that for them it's really crucial to remove a certain number of things, certain number of analysis and promises related, first of all, to things that cannot be predicted, and also related to the pathologies for which we don't have solutions. The illness of Charcot, let's say the disease of Charcot, we don't have any information and we can do nothing about this. So we actually have to explain very well that predictive analysis is very important, and I believe that this is something that can also lengthen someone's life, but this is not something that will bring us to this world that is free of any disease and any medical problem. We will still have a lot of medical problems, and we will still have challenges and problems that are related to the predictive analysis itself.
I'm also a fan of new technologies, so that I could imagine in my thoughts the vision that you just put there on the table. So actually, I got also a feeling that if we can use more all these sensors and the data is flowing from a person to the doctors, or at least the computers. So then probably it is time to go back to the basics of doctor-patient relationship, or a healthcare professional-patient relationship, and what is the role of doctors to put all that data together, help the person to live his or her life, think what is the healthy part of that person, and how to help to alleviate suffering or alleviate pain and such things. But anyway, be a supporter of that person. And I also like these traditional ethical principles that probably they play in the future a little bit bigger role. Another thing with this technology issue is that there are still a lot of people that cannot use technologies, and probably in the future also we are getting older, and older people usually don't have access and don't have capacities to use technologies, and that might be a little bit problematic, because then there are also outsiders and other people that have to support and such things, and so the things are getting also, in that sense, they are getting more problematic.
Yeah, we can see this. We have heard different points of view. So the question of to what extent is really fundamental here. So I would like to go back to you, Bertalan. I would like to ask you the following question. How can we make the patient participate in all of these scenarios that you are describing? How can we work with the patient in this prospective scenario? And I also would like to ask this question to all of the participants, because I believe that this is a very good question for today.
Absolutely. I think it's easy. We don't have to make them take active part in that. We have to follow their lead, because this revolution, this paradigm shift has been led by patients, not by medical professionals, not researchers, not policymakers. The patient empowerment movement, I think, is the biggest milestone in the history of medicine. Yes, that's how important it is, because technologies come and go. We've had technological innovations in medicine even 30, 40 years ago. But the way patients can now get engaged with their health and disease management, that's the most unique milestone in the history of medicine. So we don't have to help them or support them in that process. We have to learn from them. The problem is that because there is no ivory tower anymore, patients don't wait anymore for regulators to make a technology ready and safely accessible to them. If 15 years ago you told me that there was a revolutionary new technology coming out to the market and it was not regulated yet, what else we patients could do? We had to wait. But now there are patients who don't wait, simply because due to global supply chains, social media, community sites, algorithms in the cloud, they can make it happen. I'm thinking about the 5,000 diabetes patients who have a movement in the US. It's called #WeAreNotWaiting. And those patients have been making their own do-it-yourself artificial pancreas systems, continuous glucose monitors at home, because they knew that technologically, it became possible for them to monitor their blood glucose levels continuously, but regulators were quite slow in the first few years, and the technologies couldn't come out to the market. And if they did, they were very expensive. So patients started making their own technologies. Of course, it's not safe, it's not regulated, but I totally understand their motivation behind that. So what I teach at the medical school of Budapest, where I teach medical students, future medical professionals, is that you have to become a guide for your patients in this jungle of information and health data. We physicians used to be the key holders to the ivory tower of medicine, but that's not the case anymore. And to become a guide, you need new skills, digital literacy. You need to be able to orientate among healthcare websites and smartphone apps. You need to learn how to be able to prescribe digital therapeutics, smartphone-based, evidence-based applications for patients, and not just medications on a prescription, but now technologies, devices, sensors. But reflecting on two points that were made in the panel before that, I totally understand that because of the lack of digital and technological skills for the elderly patients, mostly they have quite a huge challenge in using these technologies. But I think the biggest challenge we face before solving that one is that even geek patients who are very good at using technologies and they feel at home when using smartphone apps and health sensors, even those geek patients with high levels of digital literacy cannot really use these technologies themselves in their care. I'm a geek patient myself. I have an amazing primary care physician who I have an equal level partnership with, the essence of the digital health paradigm shift. And when I brought the report of my genomic sequencing service to her, and we discussed how to change my diet, how to design a preventive plan for me based on my genetic risk for certain diseases, we couldn't even bring that data, that report, into my medical records because there was no way for that. The physician wanted it to make it happen. I wanted it to make it happen. And as a geek physician and a geek patient, we still couldn't make it happen. So first, let's solve this issue for those patients with high levels of digital health literacy, and then we can move to patients who have a hard time using sensors and technologies.
Merci beaucoup pour cet éclairage.
Thank you very much for this clarification. And now it actually brings me to the next question. We see that the technology moves forward quite quickly. So we have the health-related area. We have been talking about it during the very first intervention. And we see that it is very much framed. But now we see that it actually goes beyond the health-related topic. So, Jeanne, I would like to ask you, how do you tackle this topic from the legal point of view? Because we have a certain framework for the use with the medical users and applications, but we also have the patient, and I believe that the term becomes less and less relevant because we have the individual citizen who can basically use this type of tool. So how do you see this? And within the framework, from the point of view of your work, how can we place ourselves from the legal point of view? Well, yes, this is true. Whenever we are talking about this topic, we're talking about the problems related to the data associated to the patient, and we have just heard about this. We have in France and in Europe a legal framework that is very protective of a person. So the patient, yes, of course, and even the term of patient is basically sending us much more to thinking about the sick. So probably in the data related to the patient, we should talk about the person who is concerned by this data. And we are talking about the legal system that is much more protecting this person whenever we are using this data from one hand. But on the other hand, whenever we have to train this person and to predict something. Now, all of these things, whenever they will be applied in practice, that becomes a different question. But from the point of view of legal framework, we basically have everything. The biotic law of 2021 has also strengthened the rights of the person. So whenever a healthcare professional will be using a tool that is coming from an algorithm and it actually creates a lot of data and so on, the healthcare professional has to inform the person who is concerned and affected by the use of this medical tool about what it actually allows us to predict. And this biotic law has also strengthened the level of the information of the person and also let's say, the evaluation of the genetic characteristics of an individual. We can also find some constitutional genetic characteristics. So we actually have a very important legal body here and a lot of knowledge, a lot of points that are very binding. And for some, they're too binding. So today, in order to remain remain still positive because I see a lot of very tangible projects that are coming to fruition and are also associated to the patients, and also the projects related to the connected things, because that's fantastic, because some pathologies are chronic pathologies as well. I believe that some points can be improved within the legal framework that we have today, so that to make sure that we will be able to use even more easily the health-related data, once again thinking about the protection of privacy, because these are the principles that we have within our legal framework. So the very first principle that we have here, and this is something that we have seen in this August, the Council of the State has basically created this report related to the IT data and personal data, because you already know it. Whenever you collect the data, you have to collect it with a very precise goal, and it must be legitimate, and this is the main principle of the data protection, because it is true, whenever we are collecting massive data for the data centers in order to develop the algorithms of artificial intelligence, we're not always able, whenever we are creating this data center, to determine all the final uses of all of this. So this use of this final use is very important, and the RPDG basically gives us some notions with respect to this, but we probably have to broaden this scope in order to allow to the authorities protecting the data at the European level to improve their work as well. The second point is to break up with this culture of the previously used information, and this is not something that is in the RPDG. So probably this previous formality should be somehow limited in order to improve the work of all the different actors. But what is especially important is to guarantee to the person the information, that they will be informed, because this is something that will allow us to somehow facilitate the situation downstream. I believe that time is actually running very quickly whenever we are talking about all of this. Ritva, you have been talking about the ethical points. So what would be the points that we have to tackle today if we would like to prepare this transformation of the healthcare system? Probably you can explain it in 1 or 2 minutes. So if we have to start working today, what should we start with?
Actually, nowadays we talk very much about autonomy of a person and self-determination, and to give consent to treatment or research, and but we should still more talk about justice issues, so that if people have access to healthcare and access to medicines, and also in the future, if they have it or don't have it, and where I can see very many concerns in this field, and also in these new technologies, we have to study them very carefully about the benefits and harms, and so for example, these we are talking about diabetic. I like this example of diabetic, because I have treated a lot of diabetic patients. I'm a pediatrician, and so things have gone really fast in this field. But then future technologies are also genomic medicine and genetic engineering, genetic editing, and neurotechnology that have really more difficult questions about benefits and harms, risks that these technologies have. And so every new kind of technology have their own issues, and they have to be evaluated individually, and also individually with the patient. I like the idea that the patient would be a big part of decision making in the future, and it has become much more a part of future medicine, and therefore we are going to a good direction, but we always have to keep eyes open.
Thank you very much for this clarification. Just to conclude, I have already asked this question related to the patient. So is this the right term whenever we are talking about the predictive analysis or even preventing? Are we using this term, or are we using something else? The term of patient today is very much adopted. I believe that that's the best adopted term that exists here, because patient actually also includes patience, and we need a lot of patience whenever we are talking about the healthcare system. And this is actually the very core of the topic, because at the emergency you have to be the most patient. If you are going to participate in the round table where I'm talking about that I'm organizing next, I will be talking about this. So for the predictive analysis in the medical field, so where do we have the switch? The switch is that basically everyone starts to participate. So we are taking care of the sick within the medical system, the system of the healthcare, when we're taking care of everyone, which is why the question of scalability becomes the core question, because potentially in the country as France, you will be taking care of 45 to 50 million people who will be basically affected by the healthcare system. So this is not really an organization, predictive organization, where we can say that we can predict absolutely everything and it's going to be easy and everything. No, in reality, it's much more complicated. And the efficiency efforts that we say that we make or we don't make, because sometimes we're inefficient in our healthcare system today. Well, actually, we have to do this efficiency at power, 2 times the power or 3 times its power. So we actually have to get used to it and to be even more flexible than the general practitioners, because they will have a fundamental role in this predictive medicine, and they will have this vision. They already have it, but they will have to have this absolutely systemic vision of their patient, and this is fundamental. You have to tell this to your children, to those who are studying right now, because the future is generalized. It doesn't mean that we won't have a job. We will have to be specialists and generalists at the same time, and the predictive analysis in healthcare actually leads us to this. And the very last word is that the French law protects, in theory, the patient. Nevertheless, today we're talking about this predictive medicine, and in France it is prohibited to do the genomic analysis, at least in the therapeutic field. We can basically do them abroad, it's not a problem, but we cannot do this in the French legislation, and for me this is not something that protects the patient. Quite the opposite, it actually prevents the patient from benefiting from the information that can be very useful for him or her. Well, just one little word. I would like to conclude on something positive, because most often the legal framework is presented as something that is very binding and so on, but we cannot predict anything if we don't have data, which is why we have to really accompany and facilitate the access to data. And around this point, we are quite well positioned, because if you look at all the texts that we have at the European level, all the regulations that are coming and so on, you can see that France is quite well positioned, which is why we have X-data that has been also maintained in order to create the very first regulations related to the medical field here in France. Because in France right now we have a very good level of safety and interoperability. So we basically can see in all the European texts everything that has been done in France for 10 years or 12 years, something like that. So we cannot be pessimist. We will not be able to predict if we don't have the data, and we actually have to facilitate the access to the data with respect to the rights of the person, of course. So to conclude, from this round table, I would like to say that we are all coming from different backgrounds, and we can see that these topics and the topics that will be tackled later on when we will be talking about prevention, we basically have to look at different dimensions and basically go beyond the healthcare field as it is defined, and we have to work around this topic with all the economic actors. Thank you very much.